Welcome to the deep dive. Today we're diving into something really fundamental.
Yeah, this question of why some people seem more vulnerable to addiction than others.
Exactly. We've gathered insights from, well, quite a few places. Brain science, early relationships, how we act out feelings.
Hmm.
The goal is really to get beyond the surface, to
Yeah.
understand those developmental paths.
Right. We're trying to see addiction as this complex thing that develops over time. It's shaped by um, our biology, our early experiences.
And how we learn, or maybe don't learn, to handle emotions.
Precisely. It's got many layers, and we want to kind of unpack those for you.
Okay, let's start unpacking then. Our sources talk about two main ways of looking at this. First, the neurobiological angle.
Uh-huh. The brain changes?
Yeah, how substance use actually alters the brain. We're talking reward systems, motivation,
The
judgment,
VTA, nucleus accumbens, dopamine, those are the big players in the reward circuit.
and the prefrontal cortex, right? That seems crucial.
Absolutely critical, especially parts like the ventromedial and orbitofrontal cortex. Research shows less activity there in folks with substance use disorders.
And that affects what? Executive control.
Exactly. Things like planning, staying focused, resisting impulses. If that area isn't working optimally,
It's harder to make good long-term choices. Easier to go for the immediate reward.
you got it. We see similar patterns in other impulse control problems, actually. Suggests a shared biology there.
And these executive functions, they're basically our self-regulation skills.
They're the foundation, yeah.
Okay, so that's the brain side. Then there's the psychodynamic view.
This one looks more at our relationships, especially those really early ones.
And how we learn to manage our feelings, our affect.
Right. It sees addiction, fundamentally, as a struggle with regulating emotions.
And that often starts way back in childhood.
Often, yeah. And here's where it gets really interesting. The sources point to this growing link.
Between the brain science and this relationship stuff.
Exactly. A neurobiological overlap between addiction and attachment systems.
Wow. Okay.
Both involve basic drives, reward, emotional connection. Similar brain circuits seem to be involved.
So attachment theory could kind of bridge these two views.
Potentially, yeah.
Yeah.
It gives us a really useful lens.
So quick refresher on attachment theory for everyone. It's basically about those first bonds with caregivers, right?
Right. And how they shape our later relationships and coping skills.
Secure attachment, that's when caregivers are sensitive, available.
It creates that feeling of safety, security. It builds resilience.
It's like a buffer against difficulties later on.
Sort of, yeah.
Yeah.
But if those early experiences aren't so great, if caregiving is inconsistent, rejecting, neglectful,
That leads to insecure attachment.
and the sources suggest this can make someone more vulnerable to using substances.
As a way to cope. Self-medicate those feelings.
Yeah, feelings of loneliness, emptiness, general discomfort. It can become a way to self-soothe.
But important point you made, it's not destiny, right? Not everyone with insecure attachment develops an addiction.
Absolutely not. It's a risk factor, one piece of a much bigger puzzle.
Okay. And these attachment patterns can also connect to something called acting out, which isn't drama club, we should clarify.
No. It's when difficult emotions come out through actions, often negative ones, instead of words.
Like a kid being defiant or aggressive because they're upset but can't say it.
Exactly. Sulking, irritability, tantrums, those can all be forms of acting out.
And developmentally, there's a link here too.
Yeah, research connects, for instance, insecure avoidant attachment in childhood with more externalizing behaviors later.
Like aggression, rule breaking,
Possibly because emotions are suppressed and then kind of burst out behaviorally.
and disorganized attachment. That sounds serious.
It usually comes from really inconsistent or even frightening caregiving. And it's a strong predictor of problems with regulating both emotions and behavior down the line.
Is there a biological connection here as well?
Seems like it. Some studies found thinner cortex regions in parts of the prefrontal cortex.
The insula and orbitofrontal cortex.
Right, associated with more of these externalizing behaviors.
Yeah.
And we already said the PFC is key for emotional regulation and impulse control.
So it all ties together.
It really seems to.
Yeah.
And then you layer on things like social learning theory,
Kids imitating what they see.
especially from role models, like in the family. If aggressive behavior seems to get rewarded somehow,
They're more likely to copy it. Vicarious reinforcement, they call it.
right. And the coercive family process model is related. It describes these cycles where negative behavior escalates.
Like a child's tantrum gets worse until the parent gives in just to stop it.
Exactly. Which unintentionally reinforces the tantrum.
Makes sense. And for teenagers, some acting out like substance use or shoplifting, could that be a kind of cry for help?
Our sources suggest that, yeah, it might signal they just can't manage their emotions and are maybe looking for someone to step in, provide containment.
Which brings us back to the psychodynamic view on addiction itself, the self-medication idea.
Mm-hmm. Kantian's hypothesis is a big one here.
His idea is that people use specific drugs to cope with specific kinds of inner pain or deficits.
Pretty much.
Yeah.
He talks about ego functioning deficits,
Mm.
trouble managing aggression, relying on certain defenses. For example, he proposed people using opioids might be trying to numb trauma.
While someone using alcohol or benzos might be trying to quiet down intense sadness or anger.
Right, seeking sedation.
Mm.
And stimulant users might be trying to fight off feelings of emptiness, apathy, and hedonia,
Trying to feel something.
or trying to feel better, trying to manage unbearable feelings.
And research backs this up.
Yes, several studies seem to corroborate this self-medication idea.
Interesting. Other related psychodynamic concepts mentioned are things like self-deception,
Yeah, self-deceptive coping attempts, also trouble with self-care, delaying gratification.
impulsivity, novelty seeking.
All part of the picture.
Yeah.
And then there's the impact of early adversity, like abuse or neglect.
You mentioned epigenetics earlier. How does that fit in?
Well, these really difficult early experiences can actually cause epigenetic changes.
Which means
It's like experiences can flip switches on our genes, changing how they're expressed. This could potentially affect vulnerability to things like addiction, maybe even across generations.
wow, that's huge. Is there any good news there?
Well, some research suggests psychotherapy might actually have the potential to reverse some of these epigenetic changes, which is hopeful.
Definitely. Okay, let's pivot slightly to emotion regulation itself. Our sources really hammer this point home.
They do. There was a big meta-analysis looking at lots of studies.
And it found people with substance use disorders have significantly more trouble regulating emotions.
Consistently, yes.
Right.
Compared to control groups without SUDs. They used a scale called the DERS Difficulties and Emotion Regulation Scale.
And where were the biggest difficulties?
Two areas really stood out. The strategy subscale.
Meaning trouble using helpful coping skills when upset.
Exactly. And the impulses subscale.
Difficulty controlling impulsive actions when feeling bad.
Right. Acting out impulsively under distress. They also found more use of expressive suppression.
Trying to hide feelings. Push them down.
Uh-huh. And this difficulty with regulation might be a key link, a mediator, between early maltreatment and developing substance dependence later.
So the trauma happens, makes it hard to regulate feelings, which then increases risk for substance use as a coping method.
That seems to be a major pathway for many people.
And when we talk about coping, we have to mention defense mechanisms.
Right, those unconscious strategies we use to protect ourselves from difficult feelings.
The sources highlighted regression.
Yeah, that's like reverting to an earlier developmental stage when feeling overwhelmed, anxious, or threatened.
Like acting more childlike.
Can manifest that way,
Yeah.
yes. And since SUD itself can be traumatic, regression can become a coping mechanism within the addiction.
And avoidance. That seems pretty straightforward.
It is. Just staying away from things, places, people, situations that trigger anxiety, shame, or bad memories.
Like avoiding family members who disapprove of the substance use.
Exactly. It protects the person from confrontation, allowing the behavior to continue more easily.
Okay, zooming out again. We can't ignore the broader context. Trauma, ACEs.
Adverse childhood experiences, yeah. The link is incredibly strong.
Childhood neglect, emotional or physical, makes addiction 3 times more likely.
That's what one source indicated, yeah. A huge increase in risk.
And just growing up in a dysfunctional household, witnessing domestic violence.
Big impacts. Witnessing domestic violence was linked to up to 40% increased odds of substance issues later. Parental substance abuse, instability, it all adds up.
And this ACEs addiction link is seen in research across different settings.
Even in studies looking at kids involved in the legal system due to abuse, and things like starting alcohol use early, like before 15.
Also increases the risk of dependence later.
Definitely.
And then there are the sociocultural factors. Addiction rates aren't the same everywhere.
No, they vary. Higher rates reported in places like the US and Eastern Europe. And demographics matter too. Age, employment status, gender, race, ethnicity.
It's complicated. Individual vulnerability interacts with the environment.
Absolutely. Which is why effective help needs to consider all these pieces.
Let's talk about that help. What works?
Well, cognitive behavioral therapy, CBT, is a major evidence-based approach.
Helping people change thinking patterns and behaviors related to substance use.
Exactly. Trying to bridge that gap between research and what actually happens in community treatment settings.
And medications. MAT.
Medication-assisted treatment, yeah. Very helpful for managing withdrawal, cravings. But it's usually most effective combined with therapy.
Addressing the underlying issues we've been talking about.
Right. Can't just treat the symptoms.
Yeah.
And support groups, AA, NA.
Huge role for peer support, community, resources, knowing you're not alone.
Incredibly important. And for kids, showing those acting out behaviors.
Parent training programs can help.
Yeah, teaching parents strategies like positive reinforcement, consistent discipline, monitoring, helping break those negative cycles.
And psychodynamic therapy itself.
Can be very effective too, especially approaches informed by ideas about ego deficits, true false self, or trauma. Helps people understand the deeper roots.
Okay, one last area our sources touched on which might seem a bit different. Addiction to relationships. Limerence.
Yeah, it's an interesting extension of these ideas. There's a difference between healthy reliance on loved ones
Which is normal attachment.
and this unhealthy obsessive preoccupation called limerence.
What does that look like?
Intense, intrusive thoughts about the person, deep insecurity about whether they feel the same, huge emotional ups and
It
downs.
sounds exhausting.
Yeah.
And difficult to regulate.
Very. And it seems more common in people with insecure attachment styles, especially anxious attachment, often linked back to those early experiences of neglect, rejection, or trauma.
So it's like the need for validation and connection becomes this overwhelming, almost addictive drive.
In a way, yeah. It mirrors some of the intensity and the emotion regulation struggles we see in substance addiction.
Wow. Okay, so wrapping this all up, our deep dive today really shows addiction isn't simple.
Definitely not. It's not about willpower, not a moral failing. It's this complex interaction.
Brain changes, developmental experiences, how we handle emotions.
Early attachment, trauma, neglect, they can really increase vulnerability. And things like acting out are signals, behaviors pointing to deeper pain.
And understanding all these connections is just crucial, isn't it? For prevention, for treatment that actually works.
Absolutely vital. We need approaches that address the roots, not just the surface behavior.
And look, if you're listening and struggling with addiction or you're supporting someone who is, please know you're not alone.
So important. Reaching out for help, therapists, doctors, that's a sign of strength.
And leaning on supportive friends and family, that's adaptive coping too. Don't go it alone.
Which leaves us with a final thought, something for you to chew on.
Given how much these early experiences matter, how profoundly they shape vulnerability.
What can we do as a society?
Yeah.
How can we better support healthy child development right from the start?
What's our collective responsibility to tackle the things that lead to childhood adversity, to build resilience from day one?
Yeah, it's a big question, maybe the most important one. Definitely something to think about long after this deep dive ends.
Yeah.